Welcome to The Explainer. There is a massive shift happening right under our noses. For decades, the therapeutic use of psychedelics was relegated to the underground or just very quiet scientific studies. But today, we are witnessing corporate capitalism rapidly transforming the entire psychedelic landscape. It's a fascinating, high-stakes shift, and we're going to break down exactly how it's happening, what's at risk, and why this matters to you.
Okay, let's dive into this. Over the next few minutes, we're going to unpack this in 5 distinct silos. Welcome to Corporadelia, the patent thicket, biopiracy, ethics and clinical controversies, and finally, protecting the psychedelic future. So, part 1, welcome to Corporadelia.
We've officially transitioned from the quiet, careful, psychedelic renaissance into a full-blown, highly medicalized corporate gold rush. To really anchor our understanding of this new era, let's look at the term Corporadelia. It was coined by Dr. Catherine McLean, a former Johns Hopkins researcher, and Brett Green. It perfectly describes the manifestation of corporate structures, ethos, and profit-driven logic within the psychedelic landscape. Essentially, it's the absolute commodification of the psychedelic experience.
And if you're wondering exactly why corporate interests are flooding in so aggressively right now, this number tells the whole story. $10.75 billion. According to a Harvard Law Review analysis, that is the projected market value of the U.S. psychedelics industry by 2027. With that kind of cash on the table, it's really no surprise that pharmaceutical companies and venture capitalists are rushing in to stake their claims.
Which brings us to part 2, the patent thicket.
Companies are utilizing a dense, complex web of legal mechanisms to lock down control of this incredibly lucrative market. To understand how intense this land grab has become, I have a somewhat absurd question for you. Can you patent a room's vibe? I know, it sounds like a total joke, but in the modern landscape of psychedelic patents, it is a very real legal question.
Now, what's really interesting here is how historically unnovel these patent claims actually are. A British pharmaceutical firm named Compass Pathways filed patent applications that literally claimed methods of administering psilocybin in a room with muted colors, soft furniture, and get this, a therapist holding the patient's hand. Critics and underground practitioners are quick to point out that these therapeutic settings have been standard for decades. But because the U.S. Patent Office lacks historical expertise in illegal underground therapies, these sweeping patents are actually being entertained.
And it goes way beyond room decor. It goes right down to the molecules themselves through a controversial pharma practice called product hopping. Basically, this is when a company subtly modifies an existing product, sometimes just slightly tweaking its crystalline structure, and then patents the result as a brand new invention to extend a monopoly.
This brilliantly illustrates chiral chemistry, the fact that molecules essentially have left and right-handed versions, and how product hopping works in practice. So on one side, you have generic racemic ketamine. It's a cheap, widely used mixture of both left and right-handed molecules that doctors have used off-label for depression for years. On the other side, you have Johnson Pharmaceuticals' Spravato. What they did was isolate just one side of that molecule, S-ketamine, patent it, and gain FDA approval. The generic version is super affordable, but without FDA approval for depression, insurance rarely covers it. Meanwhile, the patented, expensive Spravato becomes the gatekeeper therapy, despite some studies suggesting the cheap generic version might actually be more effective.
Let's move to part 3, biopiracy and indigenous knowledge.
This corporatization isn't just a legal headache, it has profound cultural fallout. We have to ask, who truly owns this ancient knowledge? That brings us to the concept of biopiracy. This is the appropriation and commercialization of indigenous technologies without permission or compensation. You see, the U.S. Patent Office relies on prior art, meaning documented written history, to reject unoriginal patents. But traditional stewards of psychedelic knowledge often transmit their wisdom orally. Because the Patent Office completely lacks the expertise to search for unwritten histories, centuries-old indigenous practices are easily swallowed up by Western patents.
To put that into perspective, let's look at the practitioners of the Bwichi religion in Gabon. They have utilized the sacred iboga plant in their spiritual practices for centuries. In stark contrast, Western drug developers, like the life sciences company MindCure Health, have filed provisional patents for fully synthetic routes to create ibogaine. It is a really clear contrast between collective, traditional indigenous practices and modern, individualistic corporate commercialization. So the crucial point is captured perfectly by researchers in the Journal of Psychedelic Studies. They point out that when dominant medical frameworks borrow from the ceremonial expressions of marginalized groups, the original creators of these practices often end up entirely alienated from their own cultural traditions. It is a massive ethical dilemma. All right, part 4, ethics and clinical controversies.
Beyond the patents, the actual medicalization process is generating intense debate regarding clinical trials, data collection, and institutional allegiances. One of the most dystopian concerns raised by activists like David Nichols revolves around surveillance capitalism. Imagine private corporadelia companies, backed by massive big data investors like Peter Thiel or Sam Altman, gaining access to vast granular troves of biomedical data collected during highly vulnerable psychedelic therapy sessions. The real concern is that this deeply personal data could eventually be leveraged for behavioral modification or hyper-targeted marketing.
There are also intense socio-political critiques directed at major players in the space, most notably the Multidisciplinary Association for Psychedelic Studies, or MAPS. Investigative watchdogs have impartially outlined several key criticisms. These include MAPS actively pursuing right-wing mega donors to fund their research and their push to provide therapy to active-duty military and police without addressing the broader systemic violence of those institutions. Furthermore, critics point to severe, unresolved clinical trial abuses, specifically the 2015 case of Megan Buisson, a trial participant who was assaulted on camera by her MAPS study therapists.
Because of all this, activists champion a framework they call non-prohibitionist critical psychedelia. Essentially, it means we can hold two thoughts at once. We can entirely reject the failed, harmful logic of the war on drugs, while simultaneously recognizing that the clinical and corporate spaces replacing it have severe ethical problems that are absolutely worthy of rigorous critique. We don't have to just blindly accept corporate abuses to achieve legalization.
Finally, part 5, protecting the psychedelic future. With all this agitation and corporate maneuvering, how are legal experts and watchdogs actually fighting back to clean up this space? Well, one major solution is going on the legal offensive. Groups like the nonprofit Freedom to Operate are actively challenging questionable monopolies. Their strategy is pretty brilliant. First, they monitor new patent filings. Second, they actively hunt down historical samples to prove the invention already existed, for instance, sourcing psilocybin samples from as far back as 1963. Finally, they use that evidence to petition the Patent Trial and Appeal Board for a post-grant review to invalidate bad patents, just like they did with Compass Pathways' patent on synthetic psilocybin.
Let's see how this builds into even larger systemic solutions. Advocates are actually building preventative tools to fight back. One of these is Porta Sophia. It's an open-source library of psychedelic prior art designed to help patent examiners spot and reject unoriginal claims before they are ever approved. Another proposed solution is the enforceable patent pledge, where companies legally commit to keeping certain discoveries open to the public, kind of similar to what Tesla has done in the automotive industry.
Ultimately, scholars writing in the Harvard Law Review suggest we need a fundamental philosophical shift in how we view these substances. They quote the psychiatrist Stanislav Grof, who famously said that psychedelics are to psychiatry what the microscope is to biology or the telescope is to astronomy. Think about that for a second. In this view, psychedelics are not just consumer products to be boxed up and sold. They are fundamental tools of scientific discovery that should remain in the public domain, free for all to explore.
So, as the psychedelic renaissance crashes into the realities of modern capitalism, I want to leave you with this final overarching question to ponder. Should the fundamental tools of human consciousness be off limits to corporate monopolies? The way we answer that question in the coming years is going to entirely shape the future of mental health, science, and cognitive freedom. Thank you so much for joining me on this explainer, and keep questioning what you learn.